Good evening, all my dear students, my dear friends, and all my dear aspirants who wish to cherish their dream abroad in English speaking countries. Here is Abhilash Vijay Mohan Nair, the senior faculty from B-GHUD Academy. So, welcome you all on this virtual platform. Okay, hope all are doing good, fine, keeping safe and healthy. അപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നു, സമാധാനമായിട്ടിരിക്കുന്നു, ആരോഗ്യമായിട്ടിരിക്കുന്നു എന്നൊക്കെ വിചാരിക്കുന്നു. അപ്പോൾ എല്ലാ ചൊവ്വാഴ്ചയും വന്നിട്ട് സാർ ഇങ്ങനെ ആരോഗ്യവും സമാധാനവും സന്തോഷമൊക്കെ അന്വേഷിക്കുന്നു എന്നുള്ളതിൽ ഞങ്ങൾക്ക് വളരെ സന്തോഷമുണ്ടെന്നൊക്കെ ആൾക്കാർ അറിയിക്കുന്നു. ഓക്കെ മക്കളെ, ബോണി ഈസ് ദെയർ, ഹലോ, ആൻഡ് ഗോൾഡി ഈസ് ദെയർ, ഗുഡ് ഈവനിങ് മനെ. അഷ്ക രാമചന്ദ്രൻ, ഗുഡ് ഈവനിങ്, ഹലോ മനെ. So hope all are doing good, fine, you all are in safe and comfortable place, I hope. അപ്പോൾ എല്ലാവരും നന്മയായിട്ടിരിക്കുന്നെന്ന് വിചാരിക്കുന്നു. ആൻഡ് ഐ എം വെരി ഹാപ്പി ദാറ്റ് വി ആർ ഗെറ്റിംഗ് മെനി ഫീഡ്ബാക്സ് ഫ്രം മെനി ഓഫ് അവർ സ്റ്റുഡൻസ് ദാറ്റ് ദേ ആർ മേക്കിംഗ് യൂസ് ഓഫ് ദിസ് സെഷൻസ്. Extremely they are making use of these sessions. They all are appreciating us, and many are getting us some questions, suggestions and all. So like every day or every virtual platform presentation, I used to tell like, get me your feedbacks, get me your suggestions, get us your suggestions, so that we would be able to function properly, my dear Joyce and hello Mane. And I'm very happy. I will be extremely grateful to you if you provide us with some sort of guidance and some sort of suggestions and all. So please do pin your comments, your suggestions, and if you have got any queries, that is what mostly I ask my students, to get us your queries in form of questions or whatever you want, like Reshma, good evening Mane, whatever you want, like what you expect from us, you could put us you could put that before us, so that we'll be able to guide you through that way. Okay, അപ്പോൾ നിങ്ങൾക്ക് വേണ്ട കാര്യങ്ങളൊക്കെ നിങ്ങൾ നമ്മൾക്ക് സജഷൻസ് ആയിട്ട് അയച്ചു തരിക. തീർച്ചയായിട്ടും ഏറ്റവും നല്ല മാർഗ്ഗത്തിൽ കൂടെ തന്നെ, ഏറ്റവും നല്ല രീതിയിൽ തന്നെ നിങ്ങളെ ഹെൽപ്പ് ചെയ്യാനായിട്ട് നമ്മുടെ ഡെസ്ക് ഉണ്ടായിരിക്കും. So I have got my gang here, Mr. Joyson, Mr. Jobin and Mr. Vipin, those who are helping me for making this virtual platform classes possible. Without them, every time, it's not just to praise them, because we are taking they are taking much effort in making this session possible for all our students. Extremely grateful to them, especially now it is I could say like there is power cut here at MAVELIKARA from afternoon. So they are trying their level best to make this session possible. Okay, so hats off to all my dear friends, those who are my colleagues, those who are here with me to make this session possible. Apam Ashwati, good evening Mane, good evening. So hope all are doing good and fine. Once again I'm extending my all wishes, prayers and all those good thoughts, so that I want all my dear students and aspirants to be there in in your dream destinations by next year this time. അപ്പം നന്നായിട്ട് പ്രിപ്പയർ ചെയ്ത് OET എക്സാം ഒക്കെ എഴുതി എല്ലാവരും അടുത്ത വർഷം ഇതുപോലെ സമയത്തേക്ക് എന്താണ് സ്നോയി വൈറ്റ് ടെറൈനിൽ നിങ്ങളുടെ ജീവിതം ജീവിക്കാൻ ഈശ്വരൻ അനുഗ്രഹിക്കട്ടെ. മേ ഗോഡ് ബ്ലെസ് യു, മേ ഗോഡ് ദ ഓൾമൈറ്റി ബ്ലെസ് യു ടു shower into fly into weathering heads with multicolors. Okay, let the God Almighty shower His blessings on all of you. Okay, Mane Rupinder, good evening. Okay, so let us move into our session. Namakappa endu cheyyam, not wasting our time, we'll be moving to our session. So innu namakoru we have got case. Hello Mane. Yes, so now we have got some one of our students have asked me to discuss this instructing points. What are all some sentence structures that we could offer to instruct the patient when, so while giving the instruction, so what are some certain structures they want to know from me. So now I will be discussing you something which is related to instructions. Okay, thank you Mane, thank you for your good words. You're just getting me some good words, my dear students. Okay, Soumya, good evening Mane, good evening. Yes, so what are all some instructions, how we can give some instructions? Can you get me some sentence structures or some words to fill up? Okay, just like, can you just send me some words or some sentences or some structures that could that we frequently use to give guidance or instructions to our patients or those who are seeking advice from us? Okay, ആർക്കെങ്കിലും അയച്ചു തരാൻ പറ്റുമോ? നിങ്ങൾ ആരെങ്കിലും ഒന്ന് ജസ്റ്റ് ഒന്ന് ട്രൈ ചെയ്തേ. My dear students, just get me some comments. Okay, if by that we could make this more interactive, the session will become more wonderful, it would be more interesting and exciting. So I want my dear students to those who are watching me, just try to get me some sentence structures or question structures, please. Yes, how we can instruct the patient. Okay, some sentence structures that we can use to instruct our patients. What are some instructing statements that we can give, like, yes, anyone? No one? No one is writing a comment? My dear students, please make it fast. Okay, so let us start. അപ്പോൾ നമുക്ക് ചിലപ്പോൾ ടൈപ്പിംഗ് there will be difficulty in typing all those things or getting all these things. Don't worry, even if it is wrong also, I just want some sort of participation from my students. That is what always I expect. I feel like you people are there with me. If you give me some comments, if you give me some emojis, thumbs up, or some words, I'll feel like my students are there with me. So that is what I would like to yes, KS has given me. I am very happy, Maklai. I would like to provide some information regarding a current issue. Shall I proceed? Very good. That's all. I just want all of these things to happen. Okay, I just expect all these things. That is great. Anyway, it is a great thing that you people are taking effort to join me. Very good. Okay, thank you for sharing me. If there is anything else, means I'll be Bonnie. Good evening, my name. I will be very happy to listen. Will be happy to read all these comments. Okay, if any other statements are there, means you can get me. Okay, yes. So let us consider this. I would like to provide you some instruction. What you have to do is, first one, okay, I would like to give you some I would like to give you some let me explain. Okay, Sagar, very good. Let me explain some information regarding. Very good. Hello, Mr. X, how can I help you? Hello, Manetensi. Hello. So I'm very happy that all my dear students are there with me. That is what my confidence is. Here is what I'm really very happy that. Are you able to follow me? Are you able to follow me? Oh yes, that is what I'm very happy. Grace Talina, all my dear students, I'm very happy that all my students are there appreciating me, they are encouraging me. Very good, very good, very good. This is more than enough for me. Please to support me like this. Okay, yes, Maklai, are you able to follow me? How can I help you? Let me explain some information. Let me explain you, or I would like to provide you some information. What you have to do is, that is what another thing that you can. Okay, what you have to do is, okay, you should, you can use the word should. Okay, should and all is basic English structure, but never try to use it frequently. You should take food, you should take medicine now, once in a while. Mr. Martin, never forget, okay, medicines are very important, you should take that. Okay, so that intonation, that urgency, that extreme situational demands, no, you can express through should. Okay, that is what you got my point. Okay, Ashwati, thank you, Mane. Okay, what you have to do is, what you must remember is, okay, you can just give explanations like what you have to remember is, what you must remember is, what you have to do is, okay, it is very important to follow dash. Okay, it is very important to follow the medication, it is important to follow the instructions, it is important to abide by the instructions. All those things you can give, like don't forget. Okay, don't forget. Yes, don't forget. Okay, yes, any other comments from my dear students? Okay, you must remember too. Okay, you must remember too. Okay, you must remember too. So these are some statements that you can give. You must remember too. Okay, you must remember to take medicines. Okay, you must remember to follow the instructions. All those things that you have to follow. Okay, so please do write it. You can scribble it somewhere. You have to. You must take food. Okay, this is not command. In certain situations, this must, should, and will that will give more importance. That sounds like more important. Okay, so you can use must, have, and should, but try not to use it all of the time. Okay, through each and for each and every sentences or instructions, never follow the should, must, or have. But in case where you feel like you are giving some most important, extremely important information, you can use should, must, have, and all, and make sure that you're balancing it. You don't. Mr. Martin, it is a must to follow the doctor's order. Mr. Martin, it is a must to follow the doctor's orders. You should take medicines. That is what. See? Okay, you have to take a healthy, well balanced diet. All these things, I think my dear students are getting me. Okay, Grace, Mane, did you understand so far? Yes, I would like to give some suggestions regarding your current diet. Is that okay with you? Very good, Maklai. I'm very happy that you people are getting me all these things. These are the very interesting part of our presentation. Our class is like you people are just joining with me. That is what I'm very grateful to all my dear students. Hats off, salutations to all my dear students for their cooperation. Okay, you have to. It is crucial. Okay, it is crucial. It is imperative. Imperative. It is paramount. Okay, all these things are some statements that you can try, that you can give to express our instructing statements. Okay, so this is how we could. It is crucial to follow the doctor, it is crucial to have this medicines, it is crucial to get these instructions done, all those things. It is crucial, it is imperative, it is paramount, it is very important. What you have to do is, what you should try is, okay, and what you must remember is, don't forget to, okay, you must remember, okay, all these things you have to, and it is important for, it is very important, all these things. Is that acceptable to you? If you following these instructions, definitely you can see a lot of improvement in your life. I'm very happy, so thank you for getting me all these things. So see, these are certain instructing statements, the statements that you can try to give instructions when your conversation is in പ്രോഗ്രസ്. ഓക്കെ, അപ്പോൾ നമ്മുടെ കോൺവെർസേഷൻ മുമ്പോട്ട് പോകുമ്പോൾ ഇൻസ്ട്രക്ഷൻസ് കൊടുക്കാൻ വേണ്ടിയിട്ട് നമുക്ക് ഇത്രയും സെൻറ്റൻസ് സ്ട്രക്ചറുകൾ നമുക്ക് ട്രൈ ചെയ്യാം. ഓക്കെ, ഹൗ ഡസ് ദിസ് സൗണ്ട്? യെസ് മക്കളെ, ദാറ്റ് ഈസ് വാട്ട് സൗമ്യ, ഇറ്റ് ഇസ് ജസ്റ്റ് ലൈക്ക് എസെൻഷ്യൽ, ഇമ്പെറേറ്റീവ്, ഇമ്പോർട്ടൻറ്റ്. യെസ്, ദാറ്റ് ഇസ് വാട്ട് വെരി എസെൻഷ്യൽ, വെരി ഇമ്പോർട്ടൻറ്റ്, ഇമ്പെറേറ്റീവ്, പാരമൗണ്ട്, all these words you can try, you can give us an instructing statements. I hope all my dear students are following me. Yes, all are there with me? So let me tell you once more what you have to do is, okay, what you must remember is, okay, you should, okay, you have to, you must, you can use in certain extreme demanding situations, you can do all those things. It is extremely important, it is very important, it is important. Okay, don't forget to, okay, you must remember to, you have to, it is crucial that, okay, all these things that you can try. It is imperative, okay, essential, important, paramount, all these things you can try to give instructions to the patient. Okay, I hope this situation is clear to you. Okay, yes my dear students, is there anything else that is bothering you? That is just like we are taking a review, or we are taking their follow up. Okay makla, anyway, I'm very happy that all my dear students are giving me much cooperation. Okay, the session will become more and more beautiful if you join your hands with me. Okay, not only an instructing session but an interactive session. Okay, thank you all. So I hope this part is clear to all. So just get me some comments through your emojis or like buttons you can press. Okay, so if you have got this means, you can just support me by using all those things, comments and all. Okay, who's there my dear students? എല്ലാവരും ഉണ്ടോ അവിടെ? യെസ്, എല്ലാവരും എന്തേ? ആരും ഇല്ലയോ? ഓൾ ആർ സ്ലീപ്പിംഗ്? ഉറങ്ങിപ്പോയോ? നോ, അശ്വതി ഈസ് ദെയർ. Then who else is there? Yes, all are there. Okay, I'm very happy. Yes, now it's time for us to start our role play. So this question was also sent to us by one of our students, Ruth Macy. See, I'm using English. I was asking, like all my dear students went on sleeping. That is what, by hearing my sweet voice, just like KJ Shudas and all, I thought you people went into sleep, slept into sleep. That is what. So please do get me your support. Yes, we are here, sir. Thank you, Nancy. Yes, okay, Makalai. Yes, so now it's time for us to start our role play session. Soon the question will be displayed. After that, we will be having an explanation, brief description of that topic, so that you can we can go for this detailed description of this role play. Yes, now my dear Jovin, please do send the question. Okay, my dear students, the question is displayed right there. Make sure that you all are reading that question properly. Just get prepared. After that, we will go for our presentation. Okay. Yes. So the question will be there. You can go through that. I'll go for an explanation. We'll go for a discussion of this question. Okay. See, the setting is given like hospital surgical ward. Okay. You have been nursing an elderly patient who had hip replacement surgery 3 days ago. The surgeon has seen the patient today and has arranged for them to be discharged tomorrow. You have been asked to discuss the discharge plan with the patient. Okay, so this is a known case, surgical ward. The diagnosis, hip replacement surgery is the surgical diagnosis. So it's been 3 days since the surgery got over, is over. So this is a 4th day. The patient was seen by the doctor and has given discharge instruction the very next day. Okay, so totally a stay of 5 days will be there for the patient. So the next day the patient is about to be discharged the very next day. Okay, so we are here to discuss regarding the discharge plan. We are sharing those discharge information with the patient. Okay, so this is a known case. You could ask the name first itself during our preparation time. 3 minutes will be there. Collect the name and get it prepared as a known case. First itself we can ask some general queries. Okay, general well-being of the patient you can inform. Okay, we can inquire the general well-being like, oh, good morning Martin, how are you doing? All those things you can do, and later you can move on to the task. So see, the first task is like make sure that the patient has support from family or friends on regular basis until she regains independence. So we need to seek, we need to ask about the support. Okay, their support at home, that is what, whether family, friends or relatives are there till the patient gains independence, means till he or she will be able to resume their activities of normal living, that we need to inquire. So first itself it is not fair to ask the first task. So see how the patient is feeling, how is he doing. Okay, so likewise you can start the topic. Fine, ask if the patient has any other concerns about going home. Okay, so the second task is like we need to ask about their concerns, whether they have got some concerns in going home. Next, reassure the patient that physiotherapist will provide education to the patient and family regarding the mobility. So they will be having some concerns on movement and mobility. We can ask them. The physiotherapist will be there to give information. Explain that the pharmacist will deliver medications for the patient as discharged. So regarding medication, pharmacist will be there to deal with that. Okay. Explain that the patient will need to make an appointment to see the GP who will check wound and reinforce the dressing if necessary. So regarding the wound and all, we can ask them to fix an appointment with GP so that the GP will assess and do the redressing if it is needed. Okay. Next, inform the patient to call the hospital if there are any major concerns such as excessive pain, that means despite taking medication, or bleeding from the wound site or an elevated temperature. So there are, finally we need to end up the conversation by instructing them at what are all the moments by which they could make a call to the doctor's side or to the hospital side, like elevated temperature, or if bleeding is there, or if it is any excessive pain despite taking medication. So all those things that we need to discuss with the patient. Okay, so it is a known case. It is quite, I feel like it is quite a simple topic that you could easily deal with. That's the only thing is that you need to arrange the structure, you need to organize, you need to give proper tone. Okay, how the dialogue should be displayed, that should be in an effective conversation. The manner should be in an effective way. Okay, it should be very natural. Okay, so once again you can go through this question. Okay, after that we will go for this chapter discussion. Fine. So you can collect the name during the preparation time. After that we can start the topic. Okay. Yes. So how can we go for a perfect introduction of this topic? Okay, by offering some good afternoon, good morning, or whatever it is at the particular time of the day you can take to start the topic. So tell me, how can you go for a good introduction? See, I know that Reshma has given me many sentence structures. She was just carrying out the conversation. Okay, very good, Mani. I'm very happy that you are just doing a very good job. You're taking such an effort to participate in the class. Great, God bless you. Okay, my prayers. Yes. So how we can go? This is a non-case. There is no confusion regarding that. So regarding the discharge plan, we are okay. What we are going to discuss with the patient. Okay. So this is a non-case. You can collect the name. So we can call the patient as Martin or Matthew. Matthew we can call the patient, or Mart. Whoever it is, we can call the patient like that. Good afternoon. Okay, uncle, good evening. Good morning, good afternoon. Hello, good afternoon, Mr. Martin. So that would be the starting sentence. That means we need to encourage the patient. We need to boost the confidence of the patient, right? Hello, good afternoon, Mr. Martin. It's me, your nurse here. I'll be working with you today. How are you feeling now? Hope you're doing good. Okay, hope you are doing good. Okay, I'm here to discuss about your discharge and discharge plan. Okay, see, I think the doctor has explained you regarding the discharge, hasn't it? Has the doctor discussed you regarding the discharge? Okay, I thought it would be a better idea to discuss you with the discharge arrangements so that you can manage well at home. Okay, so altogether it is not necessary, but okay, Saumya and all. Yes, Mane, Saumya, you have just and was going to take care of you. Very good, Saumya. Yes, thank you, Maklai. God bless you all. Yes, so how we can give all these things are correct. So I'll be giving the version of mine. You can check it, you can go through that and can make necessary modifications. Never try to by heart the things. Instead, you can learn this and try to give a narration of yours, develop your tone and give a narration of yours. It should be natural. Okay, never ever make it as something which is by hearted or something which is mugged up. Okay, hello, good afternoon. Hello, good afternoon. Good afternoon, Mr. Martin. I'm your nurse here today. How are you feeling now? I think the doctor has come to you. Okay, has the doctor, okay, I think the doctor was here. Has he discussed you something? All those things. Okay. Okay, has the doctor discussed you the discharge plan? Has he informed you regarding the discharge? I think the doctor has explained you regarding your discharge. I hope you're happy going back home. So this is some motivating sentences. Good afternoon. Hello, good afternoon, Mr. Martin. I'm your nurse here today. How are you feeling now? Has the doctor discussed you, doctor discussed you something? Has he explained you regarding your discharge? Okay, has he informed you regarding your discharge? I think doctor has discussed your discharge. Okay, so I hope you are happy going back home. Okay, so this is what we are just asking an inquiry, a natural way of starting. I think the doctor has discussed you. Okay, isn't it? That is what we are asking with the as per your case sheet. Yes, good evening, I'm your nurse on duty today, Ruth Macy. Yes, okay, so hello, good afternoon or good morning or good evening, Mr. Martin, I'm your nurse here today. How are you feeling now? Okay, I think the doctor has explained you regarding your discharge. I think the doctor has informed you regarding your discharge, isn't it? I hope you're happy going back home. Okay, how do you feel about getting back home? I thought it would be a better idea to discuss about your discharge arrangements, discharge plan, so that you will be able to manage well at home. So that you will be able to manage well at home. Okay, thank you, Ruth, and all for giving me the messages. Okay, I hope you're very happy going back home. I thought it was it would be a better idea to discuss about your discharge arrangement so that you will feel more comfortable at home. You can manage well. Okay. that question? Yes. So I thought I thought it would be a better idea to discuss about your discharge arrangements so that you can manage well at home, so you can do well at home. Okay. Well, how do you feel about going back home? Okay. So so the patient will be saying like, oh nurse, I'm really not. Really not feeling well going back home. So we can ask like, well, what happened? Well, what happened? What is your concern in going back home? Tell me what is bothering you. Why don't you feel like going home? Okay, so we are asking, we are dealing with that second task first because we are sensing some sort of discomfort from the patient. Okay, so we are sensing some sort of discomfort from the patient. The patient doesn't looks like very happy going back home, or the patient doesn't seems to be happy going back. So we are sensing some sort of discomfort in the patient. So we are asking, well, what happened? Okay, why don't you feel happy going back home? What is your concern in getting back home? What is your problem? Do you have any concerns? Is there anything that bothers you? Okay, what is bothering you? We are asking. So that second task obviously comes to the first side because we are addressing the patient sounds not good. Okay, seems not good, like not interested in going back home. So we are just asking them, well, what happened? Okay, why don't why what is bothering you? Okay, what is the concern in going back home? Okay, what is bothering you? Okay, why don't you feel happy going back home? Okay, it seems you are unhappy, or it seems something is bothering. What is that? Okay, tell me. So they will be saying like, oh no, I'm really not confident in going back home. I feel like I should have a more stay here. I'm really very much concerned about my aftercare and all. So we can, oh, I understand. So we are just coming to that patient concern. I understand. Okay. People of your situation may feel the same way. People of your situation may feel the same. I understand. Martin, I understand. People of your situation may feel the same. Okay. But you don't have to worry. But you don't have to worry. See, the doctor has carefully assessed you. Okay. You are carefully assessed by the doctor. All your vital signs and other basic investigations, examinations were very normal. Okay, all were very normal. So you don't have to worry. You are perfectly fit to go back home. You're perfectly fit to go back home. There is nothing to be overly concerned about. Well, tell me, who all are there at home? Okay, whom do you stay with? Who all are there at home? Tell me about your family. Who is there to support you at home? And who is there to assist you in your activities of daily living? Tell me whether you have got any friends, family, or relatives. Tell me about your family. Who all are there to support you? Can you tell me, can you give me the details of your family? All these things, anything you can try. Okay, see, I have just given you many a question structure regarding the supportive, their support, family support, or regarding the patient support. So they will be giving like, all my family members are there to support me at home. Okay, then there is nothing to be anxious about. Okay, definitely I can give necessary information. I can share this discharge information with your parent, with your guardians. Okay, the carers. Okay, definitely then you don't have have to be anxious about. Okay, definitely I can share this discharge information with your carers. Okay, we will be giving you instructions to your family members too, so that they can actively participate in your home care activities. You do not have to worry. It is, we will definitely plan a discharge talk. We will be having a discharge talk with your family members or carers, or those who are your supportive members, those who are supporting you, your family members, so that they can also actively participate in your care regimen. How does that sound? Yes, nurse, I am feeling much happy. Okay, so till you gain independence, till you become self-reliant, and till you become independent, till you become self-reliant, definitely you have to seek some support from your family members, okay, from your carers. Okay, someone should be there to assist you in your activities of daily living. Okay, so definitely you can introduce your family members to us. We will be sharing discharge information and your care activities with them, so that they can also actively participate in your care regime. Okay, don't worry, definitely you will be having a speedy recovery. Don't worry, you will be definitely having a speedy recovery. You can assure them. Okay, so the patient will be saying like, okay, yes nurse, I am getting whatever you are saying, I am getting you, but what about my after going activities regarding my movement, I am afraid of fall, and also I was taking my bath myself, but I feel really exhausted after taking my bath. That is what I am really afraid of, falls, injuries and trauma. And how about my movement? What are all the activities that I should do? Okay, so what we can come to the patient side. Martin, yes, it is quite normal to feel this way. Martin, it is quite normal to feel this way. I know you are very anxious about your aftercare activities, especially you are new to this situation. See, many people of your situation are doing great after their hip replacement surgery. Many people of your situation are doing great after their hip replacement surgery. So regarding your movement, you don't have to worry. Our physiotherapist, I'll fix an appointment with our physiotherapist. They will come to you and make you learn how to organize your movements, how to plan your movements, how to carry out your movements. Definitely they will give necessary instructions and information to your family members too. Okay, so our physiotherapist will inform you, will give you necessary instructions and information on how to make a move. Okay, so your family members will also okay, they will give necessary instructions and informations to your family members too, so that they can also help you in your movements. Okay, so it is not safe to make any vigorous and strenuous movements. You can carry out your simple movement activities. Okay, you can carry out exercises, some simple flexion extension exercises as per the physiotherapist's advice. Later, as the time proceeds, you can organize your movements more freely. Okay, so you don't have to worry on anything. You can, our physiotherapist will be here. I can fix an appointment with them. They will give you necessary instructions and information regarding how to organize your movements. Even your family members will be advised of the same. Okay, so don't worry about anything. Okay, regarding, so it is not, it won't be safe to go for any vigorous and strenuous activities. You can carry out your simple exercises and simple activities, and it is great that you have taken your bath. So the patient is mentioning their bath. He was taking bath himself. Okay, it's great that you have taken your bath by self, but hereafter make sure that someone will be accompanying you. Someone is there to assist you. Someone will be accompanying you. So respecting your privacy and okay, respecting your privacy, someone should be there to assist you in your toilet activities. Okay, seek an assistance till you gain independence. Seek an assistance till you gain independence. Okay, so don't worry, our physiotherapist will let you know more about it. Our physiotherapist will let you know more about it. Is that okay for you? Is that okay for you? So they will be definitely agreeing to. Oh nurse, that sounds great. Okay, nurse, even I am concerned of my medicine, what I will do after going home. Okay nurse, what about the medications? Okay, now you don't have to bother regarding your medications, and now you don't have to bother regarding your medication. Now you don't have to bother on your medications. See, now you are in hospital. Now you don't have to bother on your medications. See, you are in hospital. we are here to give you medications. Now, intravenous medication administration is there. Once after the discharge, you will be given oral medications. There are antibiotics. There will be antibiotics to fight infection, analgesics to deal with pain, calcium, vitamin supplements. Okay, all those medications will be there, and before your discharge, we will get the medications filled for you. Okay, we will get the prescriptions filled for you. Okay, we will get the prescriptions filled for you. Okay, and our pharmacist will deliver the medicines according to your prescription. Okay. Or you can tell like our pharmacist will fill the prescription for you. He will deliver the medications and fill the prescriptions for you. Okay, you don't have to worry. Okay, now you don't have to, now you don't bother on your medications. You are here in hospital, we know how to manage your medicines. Okay, there is now intravenous therapy, intravenous medication administration is going on. Once after your discharge, you will be put on oral medications. There will be antibiotics to fight infection and analgesics for pain. Even there will be vitamin, calcium supplements. Okay, I know it would be quite confusing, but you don't worry. Our pharmacist will deliver you the medications according to the prescription, and we will get it filled for you. Our pharmacist will deliver you the medications and we will get it filled for you. Okay, if you have got much concerns or confusion regarding the medication, there will be a Webster pack. There will be a Webster pack. That means a box where these medications are arranged according to their time and order in different racks. Okay, okay, there will be a Webster pack. It is a box with different racks. We will arrange the medications according to time and time, routine and dosage. Okay, how does that sound? Does that sound okay? Okay, does that sound like an acceptable plan? Does that sound okay? So that is how you need to enrich the patient's confidence or boost the patient confidence. Hope all my dear students are getting me. Yes, give me some comments. I am not getting any comments from my dear students. Okay. Yes, it's clear now. Yes. Okay. So do you have any other queries? Do you have any other queries? Okay. So they will be asking like, nurse, I'm very happy about all these instructions that you have given me. I feel like I feel more confident. Now, what about my dressing and all, nurse? How about my dressing? Okay. But I appreciate your concern. I appreciate your concern. See, I know that you are very much caring on self. Okay. I value your concern. I know that you are very much caring self. See, regarding the dressing, you don't worry. In case if you feel like, never make it wet, soiled or contaminated. Make sure that the dressing never gets soiled, contaminated. Okay, never gets contaminated or soiled or contaminated. In case if you feel like some discomforts with the dressing, you can fix an appointment with our general practitioner. In case if you feel like, in case if you have any concerns regarding your dressing, you can fix an appointment with our general practitioner. You can come to us and they will do the needful. Okay. Okay, and in case if you feel like changing the dressing, or if you have got any severe concerns on your, if you have got any discomforts, or if you feel like changing your dressing, or if you have got any other concerns or any other discomforts with your dressing, you can definitely fix an appointment with our general practitioner and they will do the needful. Okay, so if you want, I could fix a home nurse visit to you so that she could, so that the nurse could assess your wound status daily. All right, if you want, if you are okay, or if you want, I could fix a home nurse visit to you so that so that the nurse could check the wound status daily. Is that okay? Is that okay for you, or all right? Okay, if you are okay, I could fix a home nurse visit to you so that all your wound and dressing get assessed properly. Okay. Okay, so they will be agreeing to that. So the patient will be saying like, I hope you are getting me. Are you following me so far? Are you following me? I hope you are understanding. I hope you are getting me. Okay. Oh, yes, nurse. I am very happy that you are giving me more and more information. I am very happy about discussing all these things. Okay. What we can say, like, even it is a pleasure talking to you, Mr. Martin. I know, so you are my patient, and it's our priority to deal with you. And see, even after getting discharged, okay, even after going home, okay, even after going home, even after going home, make sure that you are taking care of your health properly. Make sure that you are taking care of your health properly. Take the medicines, and see the dressing. Okay, take the medicines, see the dressing, okay, and make your activities and exercises safe. Okay, and if you have got any discomforts, if you have got any concerns with your medication, okay, if you feel okay, if you experience even after going home, if you experience some pain or discomfort, if you experience some pain or discomfort despite taking medications, or if you notice some bleeding or oozing from the wound site, okay, and if there is any elevated temperature, or if you feel feverish, never delay, get back to the hospital immediately. Okay, so we are informing the patient regarding that. Okay, and even after your discharge, make sure that you are getting your health cared properly. Okay, make sure that you are taking care of your health properly. Okay, you have to take the medication. You should take the medications as per the prescription and never skip any dosage. It is very important to finish the course. Okay, and if you notice any discomforts or any other concerns, if you have got any other discomforts, or if you notice something unpleasant or unusual, if you notice something unpleasant, or if you notice something unusual like elevated pain, increasing pain despite of taking medications, or if you notice any bleeding or oozing from the wound site, or if you feel feverish, okay, never delay, okay, never wait, you can get back to us immediately. That all could be a warning sign of wound infection. So never delay, get back to the hospital immediately. We are here to help. We are here to help. We are here to help. I feel you are more informed now. Okay, do you have any other questions for me? Is there anything else that you would like to ask or discuss? Do you have any other queries for me, or is there anything else that you would like to ask or discuss? Hope you are more informed now. I hope you are clear. You are okay. Okay. Okay, now I think you are confident in going back home, and I hope you are confident in going back home and managing self. Okay, managing yourself. Is that correct? So the patient will be saying like, yes nurse, now I feel like I'm more informed. Thank you for giving me all these informations and instructions. Definitely I'll keep your words. Okay. Well, Mr. Martin, it was really a pleasure talking to you. Now you relax. Now you take rest, relax. I will be here around. More instructions and information will be given at the time of discharge, and at that time we will discuss your discharge care activities here with your family members too. Okay, now you relax, take rest. Okay, I'll be here around. More instructions and information will be given at the time of discharge in the presence of your family members. Okay, you don't have to worry, you are safe. 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 So that could be the best conclusion statement that you can, because the patient is still continuing there. They are not going to, they are going to get discharged the very next day. Okay, so you don't have to worry, you are safe. That is the perfect way by which we could conclude the topic. No need of saying like if any all the time pressing buzzer, brochure and all. So this is the best way by which you could conclude the topic. I hope all my students, it is clear to all my dear students. Yes, yes. So that is how we are going to wind up the role play. Okay, so make sure that so this is the 30th, okay, 13th virtual platform presentation. Please go through that, all those previous topics. Okay, you can refer that and can make use of all those sessions. So many important questions we are discussing daily. Make sure all these questions are sent to me by my students, so make sure that you all are going through that. I hope these sessions are useful to you all. Please do get me your comments, your suggestions. You can pin your suggestions and comments, so that even critical appraisal, I could improvise myself if you give me some critical appraisals. Okay, so B-GHUD will be always extremely happy to help you in your study activities. So please do pin your comments, please do support us. I hope it's clear. Now it's time for us to wind up the session. Okay, so any queries, my dear students? Yes, so Shall I wind up the session for today? Yes? Get me some comments. Okay, thank you all for your presence, thank you for your cooperation, thank you for making these sessions more and more interesting, and please do share it with your friends, family members and all. Let them all make use of these things. Okay, share it with those who are needy. I hope this was an interesting session. Please do support the virtual platform class with your presence. So hope to see you on next week. Okay, so let me wind up the session. Thank you all for your participation. God bless you all. My prayers. See you all. Bye.